As we mentioned earlier, the U.S. has surpassed 5 million coronavirus cases. That is roughly a quarter of all the cases around the globe. And now health officials are really concerned that the virus may be widely circulating in the Midwest. So, emergency medical physician Dr. Uché Blackstone is going to join us now. You are in New York. You are a Yahoo News medical contributor and founder of Advancing Health Equity. So, on the subject of health equity, we know that the number one way to ensure that that this pandemic comes to an end is to get an effective vaccine, but also an effective vaccine that can be distributed widely. And there is growing concern that some more vulnerable groups that have been particularly vulnerable to the coronavirus, like African Americans, Hispanics, that there isn't a plan in place to ensure that they get this vaccine whenever it comes out. And also, doctor, when I was reading about this in an article in Politico, I was also thinking, these are groups that are very suspicious when it comes to the vaccine and medical intervention with good reason. And so I'm wondering if, you think maybe the government is missing something here. And if you're concerned that when and if a vaccine comes out, it actually won't get to the groups that need it the most.
Those are all some of my significant concerns. I think I would even back up to even before vaccine distribution, thinking about the clinical trials. Like right now, we've had a few large companies that have had phase 1 trials that have had very little diversity. The Moderna trial had about 89% white participants. And so when you're thinking about the communities that are being most disproportionately impacted by coronavirus, especially in this country, it's Black communities, Latinx, and Indigenous communities. So they have to be represented. And then in terms of vaccine distribution, I will say that whole process seems incredibly fragmented. And as you mentioned, there is this distrust between these communities and the healthcare system that's valid and justified. And so any vaccine distribution approach has to engage community-based organizations that are on the ground already doing the work in these communities and are often led by trusted leaders who community members know well and trust.
Yeah, I know it doesn't help that we already know that the hope is for the vaccine to come to the market much quicker than most other drugs and vaccines are ever able to. So we know that it's being rushed. And then we're hearing all these sort of different timelines, the end of the year, the beginning of next year, even perhaps this fall. And I think all of that contributes to a tremendous lack of confidence in what we're hearing from some members of the medical community.
Yes.
It's concerning. But, doctor, let me ask you about some countries that seem to be doing it right. New Zealand, for example, safest place in the world when it comes to the coronavirus. They've gone 100 days without a coronavirus case that was locally transmitted. Now, I understand it's an island, much smaller population. But is there anything that we can glean from the way they did it that we can apply here in the U.S.?
Yes, I mean, very early on, they took this coronavirus very seriously. They had a national lockdown. They didn't allow anyone into the country, first of all. And then also, I think that its citizens realized that it needed a collective response. So everyone had to be on board and participate in this lockdown fully. And then they also made sure that when they were reopened, that their case levels were very low. They didn't reopen with a high positivity rate. And so that also makes a tremendous difference. The interesting thing is that they never were wearing masks as much as other countries were. And that was because there were some production issues around masks there. But it also just shows that everyone's on board and you have this lockdown for 5 to 6 weeks that you can actually extinguish the virus because the virus needs our help to die out. And so, New Zealand has done it well. I think many of us are quite envious, but of course, very happy for them.
Yeah, definitely. And I know, a lot of people are going to say you can't really compare the two, but there's a lot to learn. I want to ask you about something else. Increasingly, as we have been, talking about the coronavirus, what we're finding out is that if you get the illness and, whether it's sort of bad or mild, often people find themselves dealing with lingering side effects, and they seem to run the gamut. I was speaking to somebody over the weekend who said their coworker got coronavirus in March, and to this day, she says she can't work more than 6 hours. She is dealing with overwhelming fatigue that she never had prior to contracting the virus. There are also increasing instances of lasting neurological issues. The Lancet, there was something published in the Lancet about that. Moving forward, I'm wondering, are you concerned that what we're going to start to see is some sort of almost like post-COVID syndrome, something sort of widespread where people are going to need rehabilitation, treatment, medication after surviving the virus?
Yeah, I still see patients, and I've had a number of patients who were diagnosed with coronavirus months ago still coming in with symptoms such as fatigue, shortness of breath, memory loss. And so, this is a novel virus. It's new to us. We're learning more and more about it. But what I will say so far, what we're seeing is very concerning. The Lancet study showed that not only did over half of patients with coronavirus have neurological symptoms like memory loss, loss of taste and smell, or fatigue, but when you looked at imaging, so MRIs, that there were actually structural changes months later in people's brains due to coronavirus. And so I think we're definitely going to see what we call like these long haulers that are going to be having chronic symptoms. And what's interesting is that often we have to give these work notes for people, so saying you can return to work now. It's been 2 weeks since your symptoms, but we're going to probably see people being pretty impaired in terms of their ability to go back to work over the long term.
Yeah, Dr. Blackstock, I feel like we could have you on again just to talk about that, like what this is going to look like once we're done with the pandemic and we're dealing with the post issues. Doctor, thank you so much. Always great talking to you.
Thank you.